So one of the questions that comes up with the LAIs also is, the patients will say, well, can I stop it? And I think the answer is yes, you can stop it. You can't stop it tomorrow, but you can stop it a month from now or 2 months from now. But then the next question is, well, what if I develop a side effect? Am I going to be able to deal with that side effect because I'm still on the drug? And this is something that we've looked at, pretty carefully. I think neuroleptic malignant syndrome would probably be one of the most concerning side effects. It's extremely rare amongst patients getting long-acting formulations, and there's no evidence from the cases that have developed that the outcome is any worse if someone's receiving injectable medicine as compared to oral medicine. So it's hard to, in general, these medicines are pretty well tolerated. I mean, we talk about metabolic side effects and some neurologic side effects, but in terms of life-threatening conditions, they're pretty well tolerated. So I think that's a little bit of a red herring, to say, well, I can't stop the drug. And you mentioned earlier the 3-monthly formulation of paliperidone. That was a question that I think initially came up. People were saying, well, that's a very long interval. The way that medication is used is that no one is going to have the 3-month interval until they've been on the once monthly for 4 months. So you have a chance to see whether someone is tolerating the drug well, how they're doing, and then you can introduce the every 3 month, and then eventually I hope there's going to be an every 6 month. And if you think about somebody who's maybe a little bit ambivalent about taking medication, and you realize you only have to get an injection 4 times a year, and that's a situation where maybe your relatives, your friends, significant others, whatever, can maybe help you, kind of make sure that you're taking advantage of that opportunity. So
I kind of worried that with the idea that you're supposed to take the 1 month one for 4 months before you switch over. Do you think people really wait that time?
I actually have not seen any studies to see, how it's being used. But
yeah.
I
worry that people might jump the gun.
They might, but I always tell people to try to follow the package insert.
Yeah,
There's a reason
good
why
idea.
There's a reason why it's there. And it's also are you so eager to to switch to the 3-month that you couldn't wait another month? I don't know.
I wanted to go back to something you said a minute ago, just before I forget, just about the idea of the peaks and troughs of oral versus long-acting. I actually didn't know anyone had actually looked at the side effects between long-acting injectables and oral medications. I found a meta-analysis that you were involved with, and I was somewhat surprised to find that you really didn't find side effect differences between oral and long-acting medications.
Yeah, it was very interesting.
Well, it cuts both ways, meaning that long-acting didn't have more side effects than oral, right. But the expected finding of maybe oral would be worse because of the fact you have these peak concentrations wasn't also borne out. I can't see any really negatives other than the injection and the whatever the additional effort needed long-acting. It seems to me that to have this mode of administration with constant bioavailability is a potential advantage. And I would really be interested in seeing head-to-head efficacy studies on this done. I remember there was an article that Saul Snyder and Larry Toon wrote, this is dating us, John, many years ago, where they looked at the pharmacodynamic effects of flufenazine administered by oral and by decanoate forms, and I forget exactly what the variables they were measuring, but suggesting that it was a more efficient therapeutic mode of action.